Hello, Dr. G here from naturalfoodsdiet.org. Are you one of those people that take ibuprofen before you go on a run or other type of hard exercise? Now you may have noticed that with aging, your joints and your muscles, they hurt after exercise. And if you take the drug beforehand, it reduces post-exercise pain. So today, as a public service, I want to inform you about how the FDA has strengthened their warnings about the side effects of these drugs. And they strengthened those this month, July 2015. Now, the non-steroidal anti-inflammatory medications are called NSAIDs, and that's an abbreviation. These drugs are used extensively, mainly for pain, but they already had warnings that were required by the FDA, and these were listed on the packaging. Now, included in this list of drugs are naproxen, diclofenac, celecoxib, and others. It's estimated that these drugs cause around 16,000 fatalities a year in the United States through gastrointestinal bleeding. That's where a hole develops in your stomach, your intestine, and you bleed out. When you're taking an Nsaid, the risk of a gastrointestinal bleed is about 3 times more than a person not taking NSAIDs. But the new FDA warnings are about the NSAIDs increasing your risk for heart attacks and strokes. Studies show the risk of a heart attack or stroke increases from 20 to 50% while taking these drugs versus if you weren't taking them. And this side effect can occur early on, like the first friggin' day you take it. Many of these drugs are over the counter, and it's estimated that 30 billion doses a year are taken by Americans. That is a crazy amount of pill popping. The NSAIDs can also cause kidney failure and liver damage, but those are small potatoes. Now, I know you might be out there saying, this guy's crazy. He expects me to just tolerate the pain. Now, I know that many of you out there are going to continue to take NSAIDs no matter what I say. I just want to let you know about the risks and the alternatives that you can try. They may or may not work for you, but just give it a try, at least once. One of the big uses for NSAIDs is for the treatment of arthritis pain. There's some data that suggests that taking these drugs slows cartilage healing. So in essence, the drug hastens the loss of cartilage in your joint, which increases your joint problems. This is great for surgeons, but not so great for you. What are some other ways of treating joint pain or pain after a workout? Well, one of the best standbys is ice. It's very effective at reducing pain and inflammation. Now, there's also many anti-inflammatory herbs out there. Some examples are willow bark, curcumin, ginger, and these can be helpful. Massage, yoga, stretching, acupuncture can all be helpful. One of my favorites is soaking in Epsom salts. So this helps your pain and at the same time increases your magnesium levels, which is also healthy. Krill oil supplements and niacinamide, a form of niacin, have been studied to show that they are about as effective as NSAIDs for the treatment of arthritis pain. Now, another supplement that's been used recently is denatured chicken cartilage. Sounds pretty gross, but hey, if you're desperate. Now, what if the drugs are the only thing that works for you? You could still try something different, like try a topical preparation of the NSAID. It's going to have much less systemic effects. I would say a heart attack or a stroke, no matter how you look at it, is a systemic effect. And I guess so is dying from a GI bleed. I posted several other videos that explain regenerative injection therapies, which I do a lot, and they're very effective for joint pain. What upsets me about our current medical system is how the cause for painful conditions is usually ignored. It's ignored because finding the cause is very difficult and it's usually not profitable. But there's early evidence that implicates our diet and our environmental exposures are a cause of weakened collagen, which leads to connective tissue degeneration, which then can lead to chronic pain. We have an incredible epidemic of spine and joint disorders, resulting in chronic pain and disability that shows no signs of letting up. My practice is stacked with these patients every day. My lifestyle recommendations in a nutshell: stay hydrated with clean water, morning sun exposure, plenty of DHA in your diet, avoid artificial light at night, eat unprocessed food as much as possible, and reduce your non-native electromagnetic field exposure. Now, I know it's not easy. Our society is pushing us in the wrong direction. It takes courage to push back. This is Dr. G. Thanks for watching, and please subscribe to our channel.